presentation as well by Lukan. He talked about ingenuity going beyond the limits of visualization.
Dear colleagues, I want to thank the organizers and Alcon for having me here. I will speak about my beloved ingenuity system and how it might go beyond the limits of the analog visualization. This is my disclosure regarding the presentation. So we all saw this slide, meaning that we have more depth of field, more resolution, more depth resolution, and more options for personalized color profiles. What I want to stress here is depth resolution. Depth resolution means that in all the depth of field range, we have similar focal points. So this is important because it will be related to my second slide, and it is the instrumental presbyopia. Normally, when we are looking through the oculars of the microscope, the depth of field of the microscope, the analog microscope, is actually dependent from our accommodation. So the presbyopic surgeons will have flat field. The ingenuity system actually is working with our far vision, so it is independent from the presbyopia, and it gives consistent depth of field during the whole procedure. So I think it's quite important, especially for the surgeons in presbyopic age like me. And how we can go beyond the limits, we don't need to refocus because we have depth resolution. We don't need multiple screens in such case, in some cases, because we have data fusion, we have picture-in-picture in which we can import images which are important for us at the moment. And since the camera is with highest dynamic range in the surgical visualization field in ophthalmology, we can use less amount of light. What is the meaning of dynamic range? It means that the sensor can produce image data in the lowest possible conditions, light conditions, and the highest possible light conditions. This is a window of acquisition. What we get from the analog microscope? We get a simple color eye, which we are used to. But nowadays, around that color image, with introducing of the digital filters, we might have additional 8 imaging modalities, and this is just the beginning. So, for example, this is the depth of field in anterior segment of ingenuity system without, I don't know why it doesn't work. Let's see. Can we go back, please? Just a second. So, second attempt. Yes, they are heavy, yeah. Okay, so you can imagine when you reduce the magnification of the microscope, you utilize the full range of the depth of field. This is obviously detached retina, but it is looked through the microscope without any other lenses or wide field viewing systems. So the next one is digital filter in anterior segment. During the chopping of the pieces, we lose their transparency, and by using a digital filter, we will enhance the fundus reflex, and suddenly the pieces become transparent, so we can see how deep we are going and how we chop the piece, making it safer for us and for the patient. So this is the fundus enhancement filter. This is a contrast enhancement filter. This is a regular image. This is overexposed regular image. These are other filters, and this is the contrast enhancement. This is obviously high magnification of the microscope. Still, we have good depth perception, and since this is a contrast enhancement, it actually highlights the difference between the dark and bright areas in the image, which in transparent tissues is beneficial because the cortex is similarly transparent as the capsule. So here is a direct comparison on two Ingenuity systems mounted on the same microscope with stereo bridge. And you can see on the left side the classic image, and on the right side you can see the filtered one. So it's made on purpose, of course, to show the difference between the regular image, which we are used to see, with the digitally filtered new image, which might bring more precision and more details in the picture. Here is the irrigation aspiration part of the cataract surgery. So when you have a similarly transparent tissues, we need to find the subtle differences between the dark and bright areas. So you can still see here. And this is the fluoroscopic visualization for which you already saw a presentation. But anyway, here you might see a vitreoretinal adhesion after a moment, which is important thing to see. And obviously, I am able to clean it with vacuum 590 and to touch on the whiplash effect or the field effect that we discussed with Sandro. Here I can see how my cutter is removing the vitreous, so nothing is left to chance. And this is intraoperative fluorescein angiography. Obviously, the vascular pathology cases should be more benefiting from this technology. This is diabetic case at the moment, but this was a case of hemophthalmos with unknown origin, and after the clearing the vitreous, we found that in the periphery there is occlusive vasculitis. So at least it gave us diagnosis because it's not a diabetic eye. And again, under fluorescein angio guidance, we might treat the ischemic areas. And here, last but not least, there will be a case of embolus, or is it embolus or not? And then with the intraoperative fluorescein angio, we found that there is perfusion, so these are probably arteriosclerotic plaques, but not embolus. And here, you might see a direct comparison again on two Ingenuity systems simultaneously mounted on the same microscope with the filtered image on the left side and the normal image on the right side. Again, ILM filtering, but as I said, these filters are based on the color of the dye and on the reflectivity of the fundus. So if the fundus is more pale, we might benefit better from a different filter. I have already developed 3 of them. This is the second one on the right side image. So you can see that with playing with the filters, and if we have more options, we can find in the real time the best image for our situation. Here is the second type of filter for pale fundus. And then, as I said, picture-in-picture functionality, it's quite easy to change the outputs of the screen and to see or check if your flap is where it should be, or if you drained well enough the subretinal or epiretinal fluid or around the flap, I find this option to input diagnostic source real time on the screen quite useful. Thank you.